You know, when someone shows up at an emergency room with a serious burn, it's not chaos. It's actually a finely tuned machine, all guided by a super detailed playbook. Today, we're cracking that playbook open. This is literally the official 2025 standard operating procedure for managing burns from the Gibraltar Health Authority, the exact plan they use at St. Bernard's Hospital. Let's get into it. So, why the need for such a detailed plan? Well, check this out. Burns are the fourth most common type of trauma wound in the entire world. We're talking millions of people every single year. So having a clear, effective plan isn't just nice to have, it's absolutely critical. And here's where it gets really sobering. The plan has to be rock solid, especially because a massive number of these injuries happen to our most vulnerable. Depending on which study you look at, kids under the age of 5 account for a mind-boggling 50 to 80% of all childhood burns. A stat like that, well, it tells you everything you need to know about why this system has to be perfect. Okay, so to really get how this works, we're going to follow the patient's journey from the moment they arrive. We'll look at who's most at risk, see how the hospital's master plan works, break down how they assess a burn, look at the big decision points, find out when specialists get the call, and finally follow the path to healing. Right, let's start with the big picture. We've established that burns are common, but their impact can be incredibly serious. And it's not just about young kids. A good hospital plan has to be ready for anyone who comes through the door. So beyond children, the elderly are a major risk group. Then you've got people with conditions like dementia, or folks with mobility or sensory issues who just can't react to danger in time. The playbook even accounts for the tough reality of intentional self-harm. So how do you make sure every single patient gets the absolute best care every time, no matter who's on shift? The answer is a master plan. In the medical world, they call it a standard operating procedure, or SOP. Now, an SOP isn't just some checklist somebody cooked up in the break room. No way. This is a serious evidence-based guide. It's built on the expertise of the big guns, like the UK's National Institute for Health and Clinical Excellence, that's nice, and expert groups like the London and South East England Burn Network. This is all about making sure care is consistent and top-notch. Okay, picture this. The patient's at the hospital door. The clock is ticking. The very first thing the clinical team has to do is figure out exactly what they're up against. This is the initial assessment, and it's got to be fast and accurate. They break it down into 4 key questions. First, what's the story? How'd this happen and when? Second, who's our patient? Any other health issues we need to know about? Third, let's get the details on the burn itself. Where is it? How big is it? How deep does it go? And finally, how much pain are we talking about? On a scale of 1 to 10.
But here's something you might not know, and it's a huge deal. A burn isn't a one-and-done injury. The procedure document itself says the damage can actually get worse over the first day or two. That's why great care isn't just about the first few minutes. It's about constant watchfulness and coming back to check again.
And when doctors talk about depth, what do they really mean? It's pretty straightforward. How many layers of skin got damaged? You've got your superficial burns, which are partial thickness. Then you have full thickness, which goes all the way through the skin. And in the most severe cases, it can go right down into the muscle and even the bone. Okay, the assessment's done. Now we hit the first major fork in the road. Using all that info, the team has to make a critical call. Can we manage this burn right here, or does this patient need to see a specialist, like right now? And that decision really comes down to one thing. Is the burn non-complex or complex? A non-complex burn, that's usually smaller, not too deep, and not on a tricky spot. But a complex burn, that's a whole different ballgame. We're talking deep, full-thickness burns, large areas, burns from electricity or chemicals, or any burn that hits a critical area, like the face, hands, or over a joint. So let's zoom in on something we all know about burns: blisters. You'd think it would be simple, right? Pop it or don't. But in a clinical setting, what to do is actually a surprisingly complex decision. So what does the playbook say? Well, if you have a small, calm little blister, they'll probably leave it intact to act as a natural bandage. But if that blister is large, really tense, or has already burst, they're often going to de-roof it, which is a medical way of saying they carefully remove that top layer of dead skin. And there are some really solid reasons for doing this. It's not just for looks. Taking that top off lets them see the real damage underneath. It gets rid of dead tissue that germs love. It drains away fluid that can actually harm the healing process. And it makes it easier to move, especially if the burn's over a joint. It's all very calculated. So what happens if the burn gets flagged as complex or even a simple one isn't healing right? The Playbook has a clear path for that too. It's called the escalation pathway. Basically, it's time to call in the cavalry. And this isn't just based on a hunch. It's a strict checklist. Certain things automatically trigger a call to the surgical team. We're talking about the cause, like an electrical burn, the area, like the face, the size, and for kids, even a small burn is a big deal, the age of the patient, or just a wound that won't heal or looks infected. But there's a level even beyond complex. A situation where the size of the burn doesn't even matter, because what you're seeing is a true, full-blown medical emergency. And that emergency is the risk of a really dangerous condition called toxic shock syndrome. Staff are trained to spot these red flags instantly. A high fever, a rash, vomiting, a super fast heart rate. Any of these symptoms in a burn patient, and the emergency bells start ringing. All right, so once the immediate crisis is managed, the job isn't over. Not by a long shot. The final chapter of the Playbook is all about setting the patient up for the best possible recovery. It's about the path to healing, and it's really a whole package deal. It involves super gentle cleaning of the wound, picking exactly the right kind of dressing to keep it moist without sticking, teaching patients how to care for that new, fragile skin with special moisturizers, and, this is huge, giving them and their families clear, written info so they feel empowered in their own recovery. So we've walked through this entire system, from the first frantic moments to the long-term plan for healing. What's the one big idea that holds this all together? What's the single most important takeaway from all of this? It all boils down to this one powerful sentence. The best results don't just happen. They are the direct product of a system built on teamwork, deep expertise, and knowing when to call in the specialists. So the next time you think about a hospital, just remember, behind the scenes there are these incredible, detailed playbooks, turning potential chaos into a clear path toward healing.